Good morning to you, to Abdiel, who supports us from the studios, and to all the people who follow our information every day. We begin today's briefing with the good news that it's another day with no fatalities, and we're keeping 444 patients admitted in our hospitals, 264 suspects, 180 confirmed. And this is the number of active cases we have today in our country. In our primary healthcare system, we are observing 1,736 people. Yesterday, 1,352 samples were processed to diagnose SARS-CoV-2 and COVID-19. In the laboratory of the Pedro Curie Institute of Tropical Medicine, 428 samples. In the Provincial Center of Epidemiology and Microbiology of Havana, 375. In Santiago de Cuba, 243. In the laboratory of Villa Clara, 212. And in the laboratory of the Biotechnology and Genetic Engineering Center, 94. As a result of the study of these 1,352 samples, 9 people in our country tested positive to COVID-19. This represents 0.4% of the processed 0.4% of the processed samples. And Cuba has already performed 108,389 tests using the molecular biology real-time PCRs, and 2,092 people have tested positive with COVID-19, representing 1.9% of the samples analyzed. The 9 cases confirmed yesterday, all are Cuban. 7 of them are contacts of confirmed cases. And in the overall total, 89.4% of all people diagnosed in our country, the source of the infection has been a previously confirmed positive case. All told, they are 1,384. In 2 of the people diagnosed yesterday, the source of infection has not been determined. For a total of 84 people whose source of the infection has not been identified, 4.09% of all diagnosed cases. The number of people who got infected abroad remains with no change. It's 133, the amount of people whose surface has not been abroad. 6 of the diagnosed cases yesterday are female. In the cumulative total of people diagnosed, 50.2%, 1,051 people are female. Number of people diagnosed, the female sex is already with more cases. Yesterday, 3 cases were male for an cumulative total of 1,041 cases, 49.7% were male. 6 of the positive cases were asymptomatic, 66.6%, and this number has been increasing lately. And there are already 1,093 people who have been asymptomatic at the time of the diagnosis, representing 52.2% of those confirmed cases to this date. This is a very important risk group which we cannot identify because its members do not go to the doctor, they have no symptoms, and this illustrates the importance of the need of protecting ourselves because we don't know who might be infected, and that's why we continue conducting studies to detect carriers even at the asymptomatic stage. Of the cases diagnosed yesterday, one 18-year-old girl was identified from several municipalities in Havana. She's a positive case contact, and with this, 235 children have been diagnosed with the disease on the island. And as I always say, all children have had a favorable evolution, and 208 of them have already been discharged. From the 20 to 23-year age group, 2 people were diagnosed. From 40 to 59, 3 people. And from 60 and over, 3 people. That is from 40 to 60 and over. 6 of the diagnosed cases belong to. In the analysis by provinces, the 9 cases were diagnosed in Havana, distributed in 4 municipalities of the province. And despite of this distribution in these 4 municipalities, we can say that 5 of the 9 cases are epidemiologically linked to the event reported at the ICA pharmaceutical laboratories. Yesterday, the President of a Republic, the Governor of the province, explained that this local transmission event at the laboratory resulted from the event at the Epocal store. And this demonstrates how the non-compliance, a violation of the established measures, may lead to an event of great impact for our country. For the behavior of the disease in a moment in which we were reporting a favorable course. Therefore, we cannot let our guard down at any time. Let me correct. There was an 18-year-old girl group in the one from 1 to 19 years of age, and the amount of all children who have been diagnosed with the disease is 235. Having said this, turning to the positivity rate of confirmed cases over the last 15 days, a rate per 100,000 inhabitants, Havana is on the first place with 8.29, the highest, followed by Matanzas with 3.06, Artemisa with 0.97, Ciego de Ávila with 0.69, and Villa Clara with 0.39. And we can state that as of today, 10 provinces, Granma, Las Tunas, Pinar del Río, Mayabeque, Cienfuegos, Santi Espíritus, Camagüey, Holguín, Santiago de Cuba, Guantánamo, 10 provinces and the Isle of Youth Special Municipality have not reported cases over the last 15 days. This shows that when restrictions measures are fulfilled, notwithstanding the epidemiological risk that may exist, the elimination of this disease can be achieved. Las Tunas and Pinar del Rio were added to this group today, this group of provinces and territories not reporting cases, despite the fact that they do conduct the screening, which we are going to continue screening. Of the 2,092 people diagnosed with the disease in our country, 180 remain in hospitals. These are the active cases that we have in the country today. Out of them, 176, 97.7%, have a stable clinical evolution. This is a favorable indicator. We always regret the 83 deaths accumulated in our country as a result of this pandemic, and it gives us a lethality rate of 3.96%. And with this lethality, Cuba occupies now in the region of the Americas in the 17th place. And the region has a rate of 5.62%. And there are 11 countries with a higher lethality than that of the average of the region. Cuba, I said again, is today on the 17th place. We always mention the two evacuees from the beginning of the pandemic, and yesterday only one patient was discharged. And this is not favorable, notwithstanding the fact that today we had fewer admissions, but today we had many more admissions than discharges. And this is an indicator that we also follow in the assessment of the evolution of the disease. And with yesterday's discharge, 1,827 diagnosed with this disease have recovered, and they are at different stages of their return to their normal lives, and this represents 87.4%. And today we report 4 cases in serious condition. We have 3 in the Salvador Allende Hospital and 1 at the Dr. Luis Soto Military Hospital. 1 more than the ones that we had yesterday, with the addition of 1 patient at the Salvador Allende Military Hospital. As of 12 midnight last night, 185 countries remain with diagnosed cases of COVID-19, reaching already 6,136,085 confirmed cases. In one single day, 107,950 people were diagnosed. And 2,913 people died in the world in one day, accumulating 371,857 deaths for a lethality of 6.06%. This morning, I had a few minutes available before coming here, and I visited several specialized websites, like those of the World Health Organization and others. They continuously update their date. And of these numbers we had yesterday, this morning they were reporting 98,237 more confirmed cases and 3,684 deaths. And these are very alarming numbers. And I was yesterday referring on how the addition of countries with large populations, among them Brazil in our region, make that these data be very significant from the point of view of the behavior of the pandemic. The region of Americas, with 2,904,566 confirmed cases, with 58,175 cases added yesterday, it already accounts for 47.34% of the total of cases of the world, and 163,281 people who have died in the region, 1,767 yesterday, for a lethality of 5.62%. And once again, I reiterate the importance of the restriction measures. And as we were seeing yesterday during the different addresses at the temporary group and the defense councils, a lot of emphasis was made on the importance of keeping the current measures in place. The fact that there are several territories that are not reporting new cases for several days now, this does not mean that the problem has been resolved. It is present, and one oversight can lead to peaks, to rebounds, and to a complication which our country, our people, our government, and our party do not deserve after the effort that is being made. So let's stay home, let's protect ourselves, let's use our face masks and social distancing, hand washing, everything we know about this, and our people is very well versed on all this.